Hi, can you please tell us about your experience with Dr. Rep Sundin at the Virginia Institute of Plastic Surgery?
Sure. I came to him after a long bout of medical issues, which included the effects of about 10 years of steroids in my system, and also the weight changes and other issues. And due to a tumor, I was going to have trouble having general anesthesia. What I can say is that I had a procedure in September that has greatly changed the quality of my life. I was able to non-invasively get rid of a lot of fat, including a lot of heavy breast tissue that was not going away with diet and exercise. It was a minimal recovery time, and my body's getting back to looking a little bit like it used to. My friends see a difference, I see a difference, and I just felt really comfortable here. I always thought of plastic surgery as something you do really for vanity, but it's not. There are procedures that can really change your life. And after everything I'd been through, it was really a lifesaver. I would do it again. And I'm coming back now to continue the process of healing my body. So the more I can change the ratio of fat to muscle after the steroid levels have come down in my body, the better. The more I'll be strong, fit, and able to handle more exercise. It's an upward journey that I feel here we can be a team in discussing what the next step is. The other reason I came here is I'm a physician, and I'm really skeptical of who operates on me. In the past, I've had a major spinal fusion and flew to New York for that. Dr. Rep Sundin trained at the hospital in New York that I know that is the best in the world for what it does. And given his qualifications, I felt incredibly secure staying in Virginia for this. I actually, in the past, have had surgery where he trained, and I knew immediately that he would be somebody I could feel safe with. So.
And what procedure did you have here with Dr. Rep Sundin?
I had Liposonix, and apparently I had the most that anybody's ever had at one time. But it dramatically changed a whole bunch of fat areas in my upper abdomen and abdomen, as well as actually help reduce the breast size. The goal was to avoid a true breast reduction with general anesthesia, because I was so heavy on top, and it was hurting my back, and it was affecting my ability to exercise. And I even believe as the fat has melted away that in general I'm healthier, because fat in itself, I believe, and there is some research on this, can contribute to health problems within itself. And over the 6 or 7 months since, I've seen dramatic changes. I actually have a waistline, but the biggest thing is, for me, it was successful enough as a non-operative or non-serious operative breast reduction.
And
that was a medical issue for me, not cosmetic. And the next steps are also for medical issues. I am hoping to continue the process without having to have general anesthesia, which could be quite complicated for me.
Based on your experience here with Dr. Sundin, would you recommend both the doctor and the procedure to other patients?
Absolutely. I've already actually recommended him to several physicians I know in Charlottesville area, in other places, that if they want to stay in Virginia, and I would anyway. I think for what he's doing and what his brother does, it's the cutting edge, and their training is above and by far the best. I believe in picking the right person.
Thank you.